So I'm happy for those of you who don't know her already. You should, but if you don't, I'm very happy to introduce the President and CEO of the National Alliance to End Homelessness, Nan Roman.
So let me interpret for you. Nan is really old, and she hasn't ended homelessness yet, so what the heck is going on? Well, thank you all so much for being here. As Steve said, we are just terribly grateful to you for being here. You know, a couple years ago when you were here in July, it was really hot. It was like 100 and some degrees, and we got a lot of complaints about that in the evaluation. And so David made arrangements for the temperature to only be in the 80s. So I hope you appreciate that. And that was very expensive. That was almost as expensive as the Wi-Fi connection. So anyway, we're glad to have you here, and I hope you enjoy your visit to Washington. And we're going to hear shortly also from our new mayor, and of whom we're tremendously proud, and who's been very committed to the issue. So glad to have you here in DC. I'm sorry. And also I want to say that it's just tremendously gratifying to our board and to all of us here at the Alliance that you come to our conference, that we have such a terrific crowd this year. I know numerous people have told me that colleagues of theirs couldn't get in, and I apologize for that. But we have a pretty big group, I think. So we'll next year we'll be in this hotel still, but after that maybe we can squeeze a few more people in. I can tell you that the staff here spends a tremendous amount of time putting this conference together. They really agonize over what are the current problems that you're having so that we can try to get the workshops geared toward those issues that you're facing locally. And then they comb the country for innovations, for new ideas, for successes, for speakers that can speak to those problems. And there's just a tremendous amount of content this year in particular, I think. We put a lot into that, so it means a lot to us that you all are here. And I want to thank you for being here, and most importantly, to thank you for everything that you're doing in communities around the country. So as usual, this year has held lots of challenges for us on the issue of homelessness. In the big picture, the gap between people who have and people who don't have is growing, and many people who don't have really feel that their opportunities to escape poverty are shrinking and not expanding. There are the tremendous and persistent racial disparities that we hear so much about and see so often. There are all the issues around over-incarceration and over-sentencing, and people trying to return to the communities. And of course, very, very importantly, the cost of housing is increasing, and incomes are not keeping pace with that. And that, I'm pretty sure I say every single year, but this year it seems to be particularly acute, and I think there's data that indicates that it is particularly acute. Those are I'm going to come back to that, but those are the macro issues. And in the homelessness world also, we have a set of challenges that we're dealing with. At the national level, funding is getting harder to come by. The Congress is a little ornery these days. The work that you all are doing around coordinated assessment and entry, rapid rehousing, permanent supportive housing, critical time intervention, housing first, trauma-informed care, all of those things are more sophisticated, they're more effective, but they're harder. And they require a lot of new things from you, different skill sets from the staff, different administrative infrastructures, different types of accountability. So there are a lot of challenges that we face, both from the outside and internally. But on the other hand, of course, there are always opportunities also that allow us to make progress, and this is a group that has been incredibly adept at finding those opportunities. So the conference hasn't even started yet. I was in several sessions this morning and already learned about new things that are happening in communities to deal with these kinds of issues. And look what you all have been accomplishing despite the challenges. New Orleans and Houston have ended homelessness among veterans. And also, just before I came in here, several other places told me that they're on the cusp of doing that. So that's amazing. Los Angeles County revamped its entire family homelessness system, created these. In Los Angeles County, it's really a big, complicated place. It's got, I don't know, like 80-some cities, I think over 80 cities. It's, bigger than 9 countries. It's really huge. So they created a regional crisis intake centers linking TANF and other mainstream systems with the homeless system. And within the first year, using rapid rehousing, they reduced the time families spent in crisis beds, and within the first 6 months, they'd housed more families than they usually housed in a year. Virginia retooled its family homeless system to rapid rehousing and reduced family homelessness by 25%. Go Virginia. In 2015, Minnesota decreased family homelessness 17%, New Jersey decreased homelessness 14%, Connecticut reduced homelessness nearly 12%, Long Beach, California reduced street homelessness 18% and child homelessness 24%. San Jose decreased homelessness 15%. Las Vegas reduced family homelessness 45%. I'm getting breathless. And homelessness 44%, showing that you don't have to pick one population over the other. You can do both at the same time. Utah reduced chronic homelessness 91% in 10 years, and Cleveland reduced it 75% in 9 years, and both are close to functional zero if they're not there already, so I'm not sure when this data came from. So there is a lot going on. There are a lot of exciting developments. I'm sure there are many other stories in the room. I can't name them all. But the bottom line is that homelessness overall, despite the issues with the data and all that, has continued to decrease in every subpopulation. And that is the result of smarter, harder work that you are doing. That's not just happening on its own. So there's no question that progress can be made and that you are making that progress. So now we have to think about what's next. What's next? What opportunities are there moving forward? And I'm going to talk about those next steps in a minute. But first, I want to say something about 3 things that are on the front burner for us now at the Alliance: 2 studies and 1 piece of federal legislation. The first study is the HUD Family Options Study that was released last week. This is an extraordinarily complex random assignment study on homeless families. Many of you may have seen the report. More likely, you've seen some reports on the report. The study compared the effectiveness and cost of crisis homeless interventions, rapid rehousing, transitional housing, and usual care, including shelter. The effectiveness information is not as strong in there, but the cost information is very strong. Together, the cost and the effectiveness information tell us that rapid rehousing is the most promising crisis homelessness intervention. It performs at least as well as other crisis interventions, that is shelter, usual care, and transitional housing, and sometimes better. And it is by far the least expensive at $6,000 per family per stay. And the cost is important, not because we just want to do what's cheapest for homeless families, but rather because, given equal effectiveness, lower cost means that we can help more people, and we're leaving a lot of families behind now. The study also tells us that transitional housing is by far the most expensive intervention at $32,000 per family per stay. So $6,000 rapid rehousing, $32,000 transitional housing. Transitional housing's outcomes, however, do not line up to that price tag. It doesn't have better outcomes than rapid rehousing or usual care. Our conclusion is that given that its outcomes are similar, but its costs are much higher, it makes sense for communities to look at shifting resources from transitional housing to less costly interventions that can have an equally strong effect. The study also looked at housing subsidy, basically Section 8. And on that score, it reconfirmed what you all know, which is that housing subsidies end homelessness. They definitely do. We need a lot more of them, and that is a major priority for Hill Day. We do need to get more housing subsidies. They work. But until we get more of them, What you have to offer the family that shows up tonight in your system is shelter, transitional housing, or rapid rehousing. And on that score, the rapid rehousing looks like the best bet, according to this study. And on the same subject, another report also came out within the last couple of weeks, and that was the 2014 annual report on the SSVF program, Supported Services for Veteran Families. So that's a different kind of report. It's not a random assignment. It describes the $300 million a year program, who got what, and what the outcomes of that were. So what did that report say? It said that the SSVF program served 47,000 veterans with rapid rehousing last year. So that's a lot of people. 66,000 people if you include their family members, because a third of the people the households that were housed were families. The program didn't cream. 57% of those served were disabled. The median time it took for those households to exit homelessness was 3 months. About 80% of both sheltered and unsheltered veterans and their families who got rapid rehousing obtained permanent housing. And the cost of SSVF rapid rehousing, which, by the way, was a standardized, much more standardized intervention. The family options was early on in the rapid rehousing experience, was a less standardized intervention. The SSVF cost of rapid rehousing that did the 3 core components was about $3,000 per household. There's still work going on to assess exactly how many veteran households stayed housed because of the data system disconnects, but indications are pretty clear that the vast majority of them did stay housed, families and singles. Families seem to be a little bit more likely to have stayed housed. So similar kinds of information. And very quickly, the third thing that's on our plate at the moment is the Homeless Children and Youth Act that's focused on HUD. This act addresses some very important and serious issues around doubled-up families, homeless youth, counterproductive administration requirements, and lack of data. Unfortunately, in our view, the provisions of the bill don't solve the problems that the bill raises. And in our estimation, they could make the situation considerably worse by creating a vast new eligible population of doubled-up families, because it's not just about youth, this bill. It's about youth and families. Gutting HUD's ability to address the problem strategically, and implying that no new resources are needed to serve those populations. So because of this, the Alliance opposes the Homeless Children and Youth Act, but completely supports the Senate's more productive, solution-oriented, alternative approach to these problems focused on youth. The Senate bill, appropriations bill, provides money to expand the work on youth homelessness, build the base of better data and information, and ensure that administrative requirements don't stand in the way of helping people in need. The Senate provides a more sensible approach to we think, at the Alliance, to the very important issues raised by this bill. So moving on from the issues of the moment, what are our next steps? I think the thing we need to concentrate on is getting as much done as we possibly can during the next 18 months of the current administration. The Obama administration has set very clear and ambitious goals about what it hopes to accomplish on homelessness, and it has put money and policy on the table to accomplish those goals. We have strong and knowledgeable partners, you all know them, and who we're used to working with, and we have productive relationships with, and who are clearly committed. So I think we know what's on the table now for the next 18 months. After the presidential election, no matter who gets elected, what party it is, we really just have no clue what the approach is going to be, except that it's likely to be different, because that's the way it goes. So I think it makes sense for us really to think about what can we get done in the next 18 months. And I think over the next 18 months, really, we need to act with a real sense of urgency to take real advantage of the commitments we have on the table now and get as much of the infrastructure for ending homelessness that we know works locked in while we have the opportunity to do that. So what are some of the areas we should be looking at? Well, first, I want to ask you to join me in reflecting for a moment on the really incredibly unique nature of the opportunity that we have to end veteran homelessness. Because it's just not the usual, it's rare really, that we get a chance to solve a social problem and have the resources adequate to solve it. I mean, think. I can't honestly remember another time when that has happened. We are now at a point at which the Alliance believes that we have the resources to end, or essentially to end homelessness for every veteran. We believe that we will have enough HUD-VASH vouchers to house all chronically homeless veterans, and that once that is done, we'll be able to house quite a few veterans with chronic disabilities so that they don't become homeless. We have the money, but do we have the will and the skill to make that happen? We have enough SSVF to house all of the non-chronic veterans and their families, and when they are housed, to do prevention for a whole lot more veterans and their families who are at risk of homelessness. We have the money to do that, but do we have the will and the skill to do that? And we have significant GPD and many other resources for those for whom those two primary approaches won't work. But again, do we have the will to make it happen? At least on paper, we have the resources to solve the problem, but it's really up to us to seize that opportunity. This is not a case where we can blame anybody else, that we haven't been given the resources or the tools to do it. It's complicated, but it's on us. If we manage it, if we prove that we can end homelessness among veterans, then I think we'll show that we can end homelessness overall. If we fail, despite the fact that we have the resources, it will call into question whether we're going to be able to achieve our broader goals. So ending veteran homelessness, I think, for all of us, not just for the veterans providers, but for everybody in the community, is a first call to action. We really need to do that. A second thing to focus on is to lock in on the strategies for families. I spoke about the data on interventions. Let me say this about it. Given the rising rent and stagnant income equation, which is, I'm not going to go into, but there's a lot of data emerging that this is really escalating. It's my belief that we're going to see, that we already are seeing, in fact, increasingly more housing instability among poor individuals and families, which means that we're going to see a lot more people falling into homelessness, entering the homelessness system, and more short-term homelessness. We do not have a housing voucher for every poor household that has housing instability, clearly. We cannot afford to put every household that has housing instability into a transitional facility at a cost of $32,000. And we do not want to let people languish in shelter while they're trying to save up enough money to move back into an apartment. Amen. We have one other option besides those strategies, and that is rapid rehousing. It is not perfect. It does not end poverty. It does not provide permanent housing affordability or ensure long-term housing stability or a lot of other things. It doesn't do everything. It's a crisis intervention. But then again, the other interventions that we have on offer, transitional housing and shelter, don't do that either. Rapid rehousing, though, does one very important thing for the vast majority of people it serves, and that is that it ends their homelessness. And ending their homelessness is our job. Now, there are caveats with rapid rehousing, and we need to be watching the data on it. We have to do rapid rehousing right. We need to articulate and share a clearer, more effective, and rigorous service package around rapid rehousing. We have a lot to learn from each other about recruiting and retaining landlords, especially in this challenging rental market. And again, just in the half day of pre-cons, I've heard about this, both these things from numerous people. The statistics I talked about earlier show that while a short-term intervention works for many, it is not enough for everybody. I mean, even if rapid rehousing works for 80% of people, that's 20% of people for whom it doesn't work. So we need to, for some people, that lighter package is just not enough. So we have to learn what to do differently for younger families, what to do differently for families with more children, for families with a disabled parent, and who it is that rapid rehousing doesn't work so well for. We have to learn how to do it better. So, but that's iterative, and we are getting better. We are getting a lot more sophisticated, and I think even since the family options data was collected to now, the rapid rehousing system has changed a tremendous amount. So over the next 18 months, we really need to lock in on rapid rehousing, doing more of it as the regular response to homelessness, but more importantly, or as importantly rather, we need to deliberately, intentionally be learning from each other and from local data how to do it better. Moving on to homeless youth, again, we have an administration and a Congress that have ramped up their commitment to action on the issue of homeless youth. HUD has been called to the table most recently, and as I said, I think the Senate Appropriations Bill has some wonderful provisions that supply money and support some of the needed infrastructure to get HUD engaged and the continuums engaged. HUD is terribly important, but while homeless youth certainly have housing needs, they also have very considerable service needs. And there are a lot of service interventions that could prevent and end their homelessness. And the place to look for them really is not HUD. It's much more HHS. And that really is the agency that should be leading the effort on youth homelessness and where I think we need to focus attention. And there at HHS, of course, we have the wonderful RHYA programs, and we need to beef those up over the next 18 months. HHS also has the child welfare system where a lot more engagement needs to happen, and I know that's beginning. Child welfare could be using its resources to meet the needs of homeless youth under 18. That doesn't mean putting them all in foster care, but using its resources to support community strategies around that. Child welfare can provide family intervention to keep families financially and emotionally intact so that the kids don't become homeless in the first place. It could be addressing also the reasons that foster care remains the feeder system into homelessness. Foster care experience written all over homeless families and individuals. HHS also has the whole TANF system, which is really designed to support families and children and help them connect to employment. And finally, home visiting in particular is a highly effective intervention that could do a lot more to help young families establish viable households. You know, such a high percentage in a lot of places growing of the families that are in our adult family system are headed by a young parent, 24 and under. And they're really establishing new households via the homeless system. Adult homeless system, that is not a very good idea. And I think there's a lot of evidence around home visiting, and we could be much smarter about how to help these young families, let's just say, establish a household. And finally, we desperately need to establish a coordinated system in which the Department of Education, HUD, and HHS are all pulling in the same direction and helping us all pull in the same direction. So these are things I think also that we can be thinking about. It really is a disgrace that we are not serving half the kids we already count as homeless, even though we know that count is completely inadequate. We just cannot be sitting here 10 years from now, having lost a whole additional generation of vulnerable kids and asking, what are we going to do about youth homelessness? Now is the time that we need to do something. And finally, we need to take advantage of the current administration to really lock in on the opportunities around the Affordable Care Act to ensure that our consumers, especially those with disabilities, are getting the treatment and services they need. The challenge of getting services for permanent supportive housing, the services part, has long been a barrier to our expansion of that solution to chronic homelessness. But we have now on the table resources that offer the chance to fund those services and to get people treatment and services before they become chronically homeless. And I'm sure most of you know that an information bulletin was issued by CMS a few weeks ago that clarifies what services can be linked to housing. Financing services for vulnerable people through Medicaid and these other resources is very difficult. It's incredibly complex. It's different in every state. You are not news to anyone here. The negotiation for what services will be available and how they will be available and financed is going on in every state. A lot of your organizations that want to provide services through this financing mechanism are going to have to consider a whole host of new things in order to be able to do that, including staff capacities, licensing, coverage, data systems. It's all very complicated. But it's a huge opportunity. It's absolutely critical to the people that you care about. It's extraordinarily important work. There's a lot of innovation going on around the country. In every state and many communities. There's going to be a ton of information about this during the conference from people that know so much more about it than I do. So I hope you'll take lessons from that. And I think this is something that's really critical for us to look at over the next 18 months, again, with a sense of urgency to get these systems established while we have a good environment in which to establish them. So I've left out many things. These are certainly not all of the things that we should lock in over over the next 18 months, but I would say that they are a few of the priorities that we should be looking at. It feels to me that we are at a bit of a moment with respect to the national discussion around poverty and income inequality. There are a lot of reasons why that may be true, but the media, President Obama, corporate CEOs, all speaking about the need to do something about these issues. It's getting to the point where it's just not sustainable to continue as we are. And the Pope is coming also this fall, and we're going to hear something a little bit about that, with his challenge to the faith community and to all of us to remember that the moral core of so many religious teachings is that of love and responsibility for the poor. The issues, so these are opportunities I think we have to rise above our reactive approach and participate in the larger national debate on these issues. And I know that these issues, the issues of justice and equality, are the calling of many people in this room, if not all of you. And you may not conceptualize it that way, but I know from seeing your work that you live it that way. That's what you're doing. Your answer to the moral calling, answering to that calling, and you're doing it by insisting that justice and equality not be empty promises, but something real and tangible for real people. That's what you're delivering, or you're trying to. We have a special moral call to action before us today. We cannot abandon a generation of youth because we don't have the will to figure out how to help them. We cannot be given the tools and resources to end homelessness among veterans and fail through our own lack of urgency and determination to achieve that goal. And we cannot fail to return the children who are homeless tonight to housing as quickly as possible, because as imperfect as that housing may be, it is still better than being homeless. We can be, and we must be, and we are, and you are, part of the movement to end injustice and inequality and poverty in America. You're doing that every day. You're assuming your responsibility, not just to demand justice and equality, but to create it and deliver it, or at least some measure of it, as best you are able. So I want to thank you for that. Thank you for what you do. We at the Alliance are honored to join you in this work, and I hope that our efforts will help you to achieve those goals. Thanks a lot for coming.